Hello everyone, I'm Dr. Chandan here. Today I'm going to share you the most important topics in ENT which you must know before you appear for FMGE exam. Guys, I went to the last 11 papers of FMGE and I have selected the topics which are repeated in multiple exams and which are expected to be asked in upcoming exam. So please make sure you don't miss any of these topics. So these are those topics which I divided in different parts like nose, pharynx and larynx and ear. These are very simple topics and you can easily answer questions from these topics. So make sure you learnt and remember well. Guys, first try to cover nose, pharynx and larynx. Because almost I can say 80 to 90% of the ENT questions will be from this. And then you can move to ear part. And don't think about skipping the ear part because many things ear is difficult, but this is not actually true. So try to see at least these topics which are easy in ear. So let's now know the topics which are very important in nose. Mucormycosis. Remember this is very important, mucormycosis. Then we can see trauma to the nose. Trauma to the nose, like two manifestations can be seen, like hematoma and nasal bone fracture. Next is atrophic rhinitis is again important. Then we have CSF rhinorrhea, Samter's triad, we have inverted papilloma of the nose. Then we can see Waters VU, Caldwell's VU, know this well. And next we have very small topics, and you can also see that you should also know the images on these topics, like blowout fractures, Cottle test and septal perforation causes. What are the causes of septal perforation? And another important is arterial supply to nose is also important in nose. So these things you should know before you appear for exam in nose. Next, pharynx. In pharynx, adenoid phase, again very important. Juvenile nasopharyngeal angiofibroma, it is very important. Then nasopharyngeal carcinoma is very important. You should know all the investigations and diagnosis and treatment in this. And quinsy, like peritonsillar abscess and paratonsillar abscess, you should know. And foreign body aspiration, like foreign body in esophagus, trachea and bronchial foreign body, and what the maneuver you will do, and you should know what the investigation you will do and what the treatment, how we will deal with these cases. Then very small topics in pharynx like ranula, Ludwig's angina, leukoplakia, erythroplakia. You should also know these images as well. And in larynx, if we come in larynx, laryngocele, vocal nodules, laryngomalacia, acute epiglottitis and croup. This we will also encounter in pediatrics. It's very important. So know about acute epiglottitis and croup, which is also known as acute laryngobronchitis. Then vocal cord muscles and staging of tumor you should know, and Ranke's edema. Thus guys, in ENT, know the cases where we will do conservative treatment because we can easily rule out the options. Okay, that will help us. So might be there are 5 ENT conditions where we will do 5 conservative treatment. So know that. Next, if we come to like ear part, otosclerosis again important, serous otitis media or glue ear, and benign paroxysmal positional vertigo BPPV, malignant otitis externa, and ear syringing. And devices, like in devices, indications of, like what are the indications of cochlear implant and ABI and BAHA, that is also very important. And tympanometry like type A curve, B curve, C curve, that's also one of the important. And auditory pathway, know this auditory pathway very well. And Meniere's disease again important. And audiogram and glomus jugulare. Try to cover and try to master these topics very well. And this all about you should know about in ENT, and you should make sure you have covered these topics very well. And if there is anyone who is starting the ENT for the first time and if you don't know where to study, then I will suggest you to watch the ENT video of Dr. Rajiv Dhawan sir, rapid revision video, which is available in YouTube channel. It's just 2 videos of I think nose, pharynx and larynx, and 1 Valentine videos of the ear is there. It will cover almost all the important topics. Guys, by doing this, you can easily answer almost all the questions of ENT and you can boost your score. So I hope this video will helpful, and thank you. Have a good day.